Hello everyone and welcome to the N.A.R.C.N Network. I'm Dean, the host of the N.A.R.C.N Network and channel, and also the host of the Unmasking the Narcissist channel. Today we're going to be presenting to you episode 215, and this is going to be part 1 of episode 215 because I'm not really sure exactly how long the discussion in this particular episode is going to go. But anyway, the subject of episode 215, or the title thereof, is Narcissism and Disorder Confusion. Now, what I wanted to talk about in these particular episodes is some of the stuff I'm coming across on the internet, on sites like YouTube and other sites like Rumble and stuff that carry content that is related to learning about narcissism. And of course this content is posted by narcissistic experts out there and by other experts in the psychology field, some of which who are studying a multitude of different disorders besides narcissism itself. And one of the things I've noticed, and it's not just me who's noticed this, because there are a number of other narcissistic help groups on the internet. I'm not going to name who they are exactly here in this video, but you can find tons of them on YouTube and on Rumble and on all kinds of other applications out there that are out there to help people through their narcissistic disorder events. But that being said, I'm not the only person who's particularly noticed this, but there seems to be an ongoing trend, especially over the past couple of years, but even before that, I'm noticing content that I've seen that's been posted prior to the past 5 years on the internet. And this content basically focuses around some of the other attached disorders that go along with narcissism. For this particular instance, we're going to use the example of avoidant disorders. Now, there's a great many avoidant disorder experts on the internet who claim that they understand avoidant personality disorder or avoidant disorders themselves. Whatever those may be, I've studied avoidant disorders myself over the past 5 years, and I've come to understand how they're attached in the confines of narcissistic disorder, as well as what some other experts' views of avoidant disorder are. And I'm going to be stating here in this video, or these videos, some controversial viewpoints of my own. But these are not just on my own viewpoints. These are viewpoints and information that I can tell you come from other very, very reputable sources. And some of the sources I'm going to quote here are going to be sources like Professor Sam Vaknin, who is one of the godfathers of narcissism and of understanding narcissistic disorder. He himself is a self-proclaimed narcissist. If you're not aware of who he is, look him up. It's Professor Sam Vaknin. He has been practicing psychology and all the stuff related to narcissism and other disorders for decades now. And he is a full-on, very, very accurate source of learning about narcissism and all the related disorders. Another person who's a great source of this is Jordan Peterson. Another person who's a great source of this is Richard Grennan. All these people have a very good grasp of how narcissism works and how the related disorders work. Even other people or other narcissistic experts like H.D. Tudor. If you go into H.D. Tudor's Knowledge Vault on his website or on YouTube, you'll find a great many points that are completely valid and stand as solid information towards how narcissists work. H.D. Tudor himself is a full-on higher-level narcissist. And he talks all about his narcissism, his own narcissism, as well as other famous people that we know, and just other people that we know in their narcissism. And you can get a lot of information from him that is very useful and very accurate, because he doesn't skate around the bullshit that that goes along with narcissism. He's the first person to tell you he's a narcissist, and this is what he does, and this is his behaviors, and all the other things that relate to this, and he doesn't sugarcoat anything in any particular way. He gives it to you straight up. So these are some of the other experts on the internet who are a great source of knowledge towards narcissism. But one thing I've been noticing, along with some other people on the internet, it's not just myself. Professor Vaknin has some videos on this as well too that are on his website and on YouTube over the years. There seems to be a lot of functional, I guess, functional avoidance towards trying to stay away from presenting a particular disorder as an attached form of narcissistic disorder. And one of the things I've been noticing lately, along, like I said, with a few other narcissistic experts on the internet, is that narcissism and being called out as a narcissist is very taboo. There are tons of psychologists who don't like to call out their patients as being narcissists, so they attach other disorder tags to some of the things that are going on with a person who may be able to be diagnosed as having narcissism, but a psychologist will stay away from that and try to not tag the individual as having that particular problem. We've actually talked about this in another video on the N.A.R.C.N network a few years ago, but one of the things that happens here is, if you have a psychologist who is dealing with a female patient, and that psychologist is actually female herself, a lot of females will not want to tag another female as having narcissistic disorder. They'll tell them they have something else going on. They have something that isn't directly related to narcissism. They'll stay away from that. And sadly, one of the things that's going on here with all this happening like that is that you have people who are narcissists being misdiagnosed as not having NPD. They're being told they have antisocial personality disorder. They're being told that they're just bipolar. They're being told that they have some other type of ischemic disorder. They're being told all these things, and they're not being told that they actually have narcissism and that they are displaying narcissistic traits. Now again, when a narcissist goes to see a psychologist, it's very difficult for a psychologist to determine that that person actually is a narcissist. Why is that? That's because narcissists don't want to display their narcissism even in front of psychological professionals, because then it tags them as being possibly a narcissist. They may be diagnosed as being a narcissist. And as we know, narcissists do not want to be pulled out of the woodwork as being narcissists, so they will not show a psychology professional who they really are in that instance, even if they may be seeking help to get away from their narcissistic behavior. They will steer clear of that particular thing completely if they can. Now, this is understandable. Nobody wants to be tagged with being a narcissist. It's not a pleasant thing, and because of this, many psychology determinations as to what's going on with people happen to be the wrong clinical determination, because the psychologist either can't see that that person actually is a narcissist, or they can see that they have the red flags of narcissism, but they don't want to tag that person as being a narcissist because it puts them in a position of, now this person suddenly knows that they are a narcissist, and they have to, or they may have to adjust accordingly to stay away from that. So again, when we look at individuals seeking psychological help who may have narcissism, they may be getting themselves into positions where their narcissistic disorder is misdiagnosed simply because that psychologist doesn't want to tag them with that particular moniker because it can be very detrimental to their patient and may not be helpful to the patient. But in the long run, understanding that you do have narcissism is, in fact, very helpful for you to be able to get away from that. I personally know people who are now in therapy for narcissism, some of which are doing very well because they now recognize they are narcissists and that they have narcissism. Some of them have had narcissism since they were children, and they have just become aware of it, and they are taking the steps to get themselves away from that behavior and to reform themselves, and they are doing very, very well at this. But again, as we've talked about on the channel before, only less than 1% of narcissists seek psychological help or therapy, and out of that less than 1%, half of them don't even follow through, half of them aren't successful with it, they give up before they get to that stage, or they go see a psychologist and they get misdiagnosed, and everything just goes awry at that point and nothing really particularly gets done. So this is part 1 of episode 215. We're going to continue in part 2 here in a moment. What we're going to go into in part 2 is some of what I was basically starting to say earlier in this video about how some other disorders are being brought into the fray of diagnosis for what is essentially actually narcissistic disorder. So we're going to talk about one of these particular disorders in part 2 here, and we're going to go into that in just a moment. So please stay tuned. Part 2 is coming up next year. Going to catch you guys in a couple of minutes, and we'll continue with this discussion on narcissism and disorder confusion.